Hello and welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Thank you for joining us. Our guest is Dr. Matt Miller, PhD, and Vice President of Behavior Science at Staywell, a recently acquired Merck company. And he's joining us here on the program today to talk about how VR, or virtual reality, and AR, augmented reality, are being prescribed to patients to reduce stress and anxiety and manage a number of health conditions. Welcome to the program, Dr. Miller.
Thank you so much for having me.
Now, you're a PhD and the VP of this company of behavior science at Staywell. Give us a bit of background about yourself.
Yeah, sure. So my PhD was at the University of Minnesota. I studied social and behavior science. I was focused on health promotion efforts. And after graduating, I worked as a mental health professional for a little. I had previous graduate training in psychology. I worked for a few years at the individual level before really just getting the itch to try and scale some of the intervention efforts that I'd been designing. So instead of working one-on-one with folks and after a busy day impacting 10 or so people, really interested in having a scaled impact. So I joined a few health tech startups for a few years, and then I found my way to New York and worked at Johnson & Johnson for a couple of years, working as a behavior scientist, building health promotion efforts for them. And then just about a year ago, I moved back to the Midwest and I joined Staywell's team. And at Staywell, we do population health management, lifestyle risk management, and I'm in charge of new product development, of health coaching, and then of research for Staywell.
What role does behavioral science play in what you call the population health management?
Yes. Yeah, great question, Neil. So historically, the way we did population health was providing content, right? It was purely information dissemination. If you have a health concern, if you have a health condition, what we did was give you a booklet on it. And we expected that booklet alone to fix you. We learned over the next 40 years or so that those initial efforts weren't as effective as we thought they were. And so as we zoomed in and realized that human behavior and health behavior in particular is really messy. It's really complicated. People don't necessarily do the things that you think they would do. They don't necessarily do the things that are in their best interest for a variety of reasons. And many of these fields have now joined forces with behavior science, which is really the study of human behavior, to try and better understand why it is that people are doing or are not doing the things that they need to in order to ensure better health outcomes.
When it comes to compliance, is AR and augmented intelligence, are these things that help with compliance? Because you said people don't do the things that are in their best interest. How does virtual reality and augmented reality help with compliance and to get people to better manage their health on a personal level?
Yeah, that's a good question. So just to make a distinction for your listeners, so with AR and VR, what we're talking about are immersive realities, digital realities. So things where you look through your phone and you see something different, or you put goggles on and you see something different, and you're either in the room that you're in, but there are additional elements added, or you are taken to someplace. The easy way to answer your question is that we don't totally know if it's going to boost compliance in the long term. In the short term, what we found, though, is that it is a novel engagement strategy that many people are receptive to. And this is particularly true during procedures. It is also true for folks who haven't been as receptive to the historical mechanisms that population health has pursued, which is just that here's a booklet on your condition, or here's a booklet on how to manage your health. So this is the next gen, so to speak, of that. But again, I would caveat that by saying the evidence on efficacy is still emerging. So we're confident in it, but I would love to have a conversation with you in a year or so after we've got some large scale data to support what it's actually doing and how it's actually driving compliance.
What do you say to people that have experienced, say, a VR helmet or an augmented reality helmet or some other device to enhance or augment the reality? What do you say when they say, well, aren't you simply hypnotizing people or manipulating thought processes? Those can be taken in a negative way. How do you what do you do to combat that?
Yeah. This is not manipulation. It is coaching. It's not heavy-handed. It is very light touch. If I could just talk a little bit about the experience, is that an okay transition?
Absolutely.
Cool. So in our VR platform, we've got a few things that are happening. So I would just zoom back and say, we've got some evidence to suggest that digital reality intervention, so using VR as a medium, can be effective for pain management. There are also a number of instances in the literature now supporting its use as an exposure therapy to treat phobias. So people have been treated of, fear of spiders and fear of heights and other things through virtual reality mediums. In our context, we combine a few things. We've got a centering element, and then we've got an exposure to nature element. In the centering element, I guess I would split it, and I would say part of it that's focused on cognitive centering, and then part of it that's focused on biological. So in the cognitive centering space, we've got a component of it that is really mindfulness. It's mindfulness. It is coaching you as the user to let your thoughts go. You are not your thoughts. And then there's also a component of it that is really based in cognitive behavioral interventions, which is all about reframing things that are actually cognitive distortions. You're thinking this, it's not actually grounded in reality. We challenge you to think something different in order to support your eyes so that they can see reality as it is versus this previous distortion that you've been embracing. So there's this cognitive centering piece. There's also a biological centering piece, which is about deep diaphragmatic breathing. It's about progressive muscle relaxation. And so those components really centering. And then the unique part about what we are doing is that there's also a preserved element to it. We're actually exposing you to nature scenes that you can interact with as part of your experience. And that's sort of novel. If you are familiar with, there's a guy named Robert Ulrich in the early 80s who did quite a bit of research on health system patients. And he found that patients in hospitals that had rooms that opened up into courtyards, so rooms that had windows that looked onto gardens or trees, that they healed faster. They had lower infection rates. They left and went home earlier. And everyone sort of scratched their heads and said, well, that's got to be some sort of statistical and replication studies. And for the most part, they were able to reproduce the results every time. And out of that, they organized the data into a couple overarching theories, stress reduction theory and attention restoration theory. And since then, this sort of idea has actually been implemented in a variety of countries. The UK has a program, Sweden has a program, New Zealand has one. There's one in Japan. And all of these programs, to some extent, they're effectively telling you as a citizen or you as a patient to go spend time in natural elements in order to boost your health. So what we have said is, okay, that research is really interesting. What if we put people in a digital reality environment that exposes them to those same types of preserved natural stimuli, and then we overlap on top of that the biological centering and the cognitive centering that we've talked about? If we coalesce all of those, is there actually a synergy there? That's what we are hoping to tell.
Now, very briefly, is there any patient or client preparation necessary before implementing the therapy?
Yes. We don't have a formalized booklet at this point. This is still a fairly simple for us. When we set clients up with it, we tend to encourage them to start sitting down so that we don't have any vertigo. And we give just a little bit of preparation to explain what the experience is like. And really, the extent of that is saying that the intent of this is to provide you with a novel form of mindful meditation. And, oh, by the way, here's how to control the platform. Here's how to focus the goggles, and here's how to interact with it. So if you turn your head from side to side, the way that you can expose yourself to the scenery, and here's a volume control. So they're fairly tactical, fairly high-level, simple instructions at this point, and we haven't needed to give any additional coaching to try and frame the experience, and it's still been received well and been successful.
Well, in wrapping up, where can we go online and get some more information about about how AI and virtual reality and augmented reality are being used in healthcare?
Yeah, we've got quite a bit of stuff on our website, staywell.com, and we will be putting out additional white papers and videos documenting the progress with our VR platform in the coming year. So feel free to check out staywell.com now and then stay tuned as we put out more content there.
Thank you so much. Lots of great information. It's been a pleasure, Matt. Thank you for joining us today.
Thank you, Neil. Take care.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in and download at SoundCloud, and be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.
Thank you for listening to Health Professional Radio. We're very proud to be an independent broadcaster providing our content free of charge to you, the listener. One of the ways that we're able to remain free and independent is by having people like you become patrons. You can support Health Professional Radio simply by visiting hpr.fm and clicking the button that says Become a Patron. Your patronage of even just $1 a month lets us know that you're there, which in turn makes us more valuable to advertisers. And, of course, if you're able to afford more, then we would certainly appreciate the support. My name is Toby Longhurst from Health Professional Radio. Please visit hpr.fm, click the Become a Patron button, and support us if you can.